Hi, everyone. I'm Kip O'Dell. I'm Programming Manager at Kent District Library. Thank you so much for tuning in tonight. We have a very interesting program for you. Make sure that you go to kdl.org/events to see all of our other programs that we have streaming. We have a lot of different things. Actually, coming up next week as part of our Wednesday evening What We're Learning series, we're going to be doing a Q&A time and interview with Jose Chacha Jimenez, who was part of the Young Lords, a national human rights movement. And that's going to be very interesting. That's going to be at the same time next Wednesday at 7 p.m. For tonight, I'm going to introduce our speaker for you. We are going to be talking about the Medicare maze tonight. And our presenter is Michelle. Michelle joined Senior Neighbors and the Medicare Medicaid Assistance Program back in 2011 and has been helping Medicare beneficiaries navigate the health insurance options ever since. Both Senior Neighbors and MMAP are dedicated to helping seniors and other Medicare beneficiaries by providing free and unbiased insurance counseling. So I'm going to bring her into the stream here. Hi, Michelle. How are you?
I'm good. Hi, everyone. Thanks for joining tonight.
And I'm going to go ahead and start your screen share here, and you're off and running.
So as Kip said in my introduction, I have been doing insurance counseling, specializing primarily in Medicare and helping people navigate the maze that Medicare is. There's a misconception that Medicare is simple and it's easy, and anybody who's on Medicare knows that that's not the case necessarily. So tonight we'll be talking about just the basics of Medicare, what are your options with Medicare, and what sort of things should you look for when selecting a Medicare health plan. We will stop for questions kind of throughout. Medicare is one of those things that it's easiest to take the questions in the different sections as we talk about different parts of Medicare. I do ask that questions are general. If you have specific health insurance questions about either your policy or your specific situation, I ask that you connect with me one-on-one for a counseling appointment or with my support counselor that's in the department. Insurance is really an individualized service, and so it's hard to answer specific questions about specific plans just because there's a lot of things that can affect how you might have certain benefits. So I'm definitely open to general questions if you have any. I know that this information is not necessarily easy, but I do ask that we try to just focus on more general concepts during this time. So to start, what is Senior Neighbors and MAP? So I've been with Senior Neighbors since 2011. I've had many different roles while I've been there, but I've always kind of focused in insurance as part of my job. So Senior Neighbors, we're a nonprofit funded primarily through the Kent County Senior Millage, and we offer many services to seniors. Our, criteria as a senior is age 60 and older, and mostly to seniors who reside in Kent County. For the Medicare Medicaid Assistance Program specifically, we can work with the seniors that are in Ottawa County as well, because Ottawa County and Kent County share the same health plans. So if you are watching this from Ottawa County, we can still provide assistance. And our services at Senior Neighbors are really focused on helping you to maintain and improve your quality of life in your living setting. So if you're living independently, we want to try to keep that the case. If you need, assisted living, if you're living in assisted living, what services can we do to help that? So my program specifically is in the Medicare Medicaid Assistance Program. And that is a statewide nonprofit that provides free and non-biased insurance counseling. So we do not sell insurance. We know about all the different insurance types, and there's a very specific way that we offer our services to try to keep that unbiased. And I'll talk a little bit more about what a counseling session with a Senior Neighbors MAP counselor looks like, and how it's not a sales pitch because we don't sell. So in our MAP team, there's 2 counselors this year. So just a little bio about both of us. Mine was kind of covered in the introduction. Like I said, I've been with Senior Neighbors since 2011, and I've been a MAP counselor since that time. And then in my department, I also have a support counselor, a Medicare specialist. Her name's Brianna. She returned to Senior Neighbors last year to fill the Medicare Medicaid Assistance Program specialist position. And she was trained in MAP starting in 2018 when she did her internship actually with Senior Neighbors. So this will be her third enrollment season. I bring this up because a lot of people have some nerves about doing counseling with someone who might be new. And both of us have experience in the area. So whether you're working with me or if you work with Brianna, either one of us can help you and are both experienced in providing insurance counseling. We also have an intern who may help, but she would not be doing any one-on-one counseling without supervision. I bring that up only because if you do call us for an appointment, she may be on the phone with us, or if it's an appointment that happens by Zoom or Microsoft Teams, she may be part of that meeting, but she wouldn't be doing any counseling directly. Okay, so this is the stuff you're here for. The 2021 updates. A lot of this gets announced much later in the year. The only thing that we know right now is that the Social Security cost of living increase is going to be 1.3% for 2021. This is good. I wasn't sure if we would see a raise this year given everything that's going on, but that 1.3% increase will equal about $15 to $20 per month for most beneficiaries. Again, it depends on what your Social Security benefit is. But that's about the average for the cost of increase is about $15 to $20. The Medicare Part B premium gets announced usually around mid-November. It is forecasted to increase to about $153.30 for 2021. It hasn't been officially released yet. This is just the forecasted amount. Usually the forecasted amount is pretty accurate though. Same thing with the Medicare Part B deductible that gets released later in the season. Last year, it was $198, and it is forecasted to be $212 for 2021. And the Medicare Part A deductible is expected to be $1,452 in 2021. Again, the last three things have not been officially released yet, so this isn't written in stone. It may change. But this is just what people are expecting to see. I always like to take a second to talk about new Medicare cards. Almost everybody has their new Medicare card now, but if you have not, you do want to make sure you have this card. You can get a replacement by calling Medicare. You can reach out to one of us at Senior Neighbors and we can help you to get this card. But these new cards look like this picture here. And they started to be released in 2018. The primary reason why we released these, or the new Medicare cards were released, was to help protect your identity and cut down on health insurance fraud. Some of you may know, because you may have had the old cards, that the old Medicare card was simply your Social Security number with a letter at the end in most circumstances. And obviously that's a big security issue. So Medicare in 2018 decided let's release a new card with a randomly generated number, one that can be changed if it gets lost or stolen. And that's why we have these new numbers that are kind of crazy and are no longer a Social Security number. In January 1st of 2020, they stopped taking the old Medicare number. So that's why most people have their new Medicare card. However, if you have an Advantage plan, it is possible that you don't carry your Medicare card because you don't necessarily need to. And you may have filed away your old card and not received your new one. Although you don't use your Medicare card if you have an Advantage plan, it is really important that you still have your new Medicare card. And in order for us to provide counseling, one of the hard things is we tell people, don't give out your Medicare number. But if you do call for an appointment, it is possible and probably likely that we would need this number to provide you the best one-on-one counseling experience. So we may ask for that number. If you are not comfortable providing that, you don't have to do that. But then there may be some limitations in some of the information we're able to provide you about your coverage. So before I go on to original Medicare, I just want to see if there's any questions on the first part. Okay, so going on to original Medicare, Medicare is split into two parts. There's Medicare Part A and Medicare Part B, and they each cover separate services. One of the biggest things to know about Medicare is that it is a really old system. It's based on a really old system of insurance. Medicare came out in the 1960s, and it's structured on insurance plans that would have been offered at that time. So it is kind of a difficult program to understand in the sense that a lot of us, insurance has changed a lot since the 1960s, and a lot of us are not familiar with old structured health insurance. And that's kind of what Medicare is based on. So Medicare Part A covers most of your major services. So inpatient hospitalization, skilled nursing, hospice care, and any medically necessary home care. Medicare Part A is by far the most expensive part of Medicare as far as out-of-pocket cost, because you have a really large hospital deductible. And this number is likely to go up next year, but as of 2020, it was $1,408. The big thing to know about the hospital deductible is that it's not an annual deductible. So a lot of times when we talk deductibles, you pay that one time a year. Once you pay that, it's done. With the hospital deductible, it's actually something that you can be charged every 60 days. And so, if you had 1 year and you're in really bad health and you're hospitalized frequently, you could end up paying that deductible up to 6 times. I honestly have never seen anyone pay it 6 times. I think that is a kind of a catastrophic situation, but I have had people who have paid that deductible 3 times in a year. And, that can add up really fast. How Medicare decides how often you pay it is based on what they call a spell of illness window. And that is a 60-day window from hospitalization and to the next hospitalization. So if you go into the hospital in January and then you go back in February, you're only going to be charged that deductible one time, because your hospitalization in February happened 60 days within 60 days of your hospitalization in January. But if you go into the hospital in January and then you go back in August, you will have 2 separate deductibles. The other thing that Medicare Part A covers that is a common service is skilled nursing for rehab services. So you can get up to 20 days at no copay with additional charges after those 20 days. But the big thing to know is that these are not a guaranteed 20 days. You have to be rehabbing and making progress in order to get the full 20 days. If you have a stroke, let's say, and you go into a rehab facility for services, and your recovery kind of plateaus and you're safe enough to go home within 10 days, you're probably going to be discharged home in 10 days. On the flip side of this, it also doesn't pay for Medicare. Medicare doesn't pay for you to go to a nursing home to live on a long-term basis. That's actually Medicaid. And there's no monthly premium for Medicare Part A when you're in retirement, because you have earned those through either your record or your spouse's record of 40 work credits. And work credits used to be really easily calculated. The calculation has changed. But the best way that I explain it to people is it's equivalent to about 10 years of full-time employment or part-time employment, 10 years of employment. So if you worked about 10 years or you were married to 10 years to a spouse that worked about that time, Medicare will be free for you. Also, if you have been disabled a lot of your life and say you haven't been able to work because of your disability, there may be some ways to get Medicare A still free. Now, Medicare Part B is by far the most commonly used services. This covers any medically necessary services such as office calls, tests, or diabetic supplies. There's a lot of other things that it covers. It does cover some medications. It does cover some vaccines. But most people are getting services within this list. And with Medicare Part B, you have an annual deductible of $185. Again, that number is for 2020, likely to go up in 2021. And generally Part B pays 80% of your claims, and then you pay 20% after that deductible is met. And then Medicare Part B, you do pay a premium for even once you retire, and the premium is $144.60 as of 2020, and it's likely going to go up in 2021. I can almost guarantee it will go up in 2021, but that premium is usually deducted right from your Social Security check. If you are someone who is not receiving Social Security but still receiving Medicare, you will receive a quarterly bill for that amount. I say put a special emphasis on the quarterly because you have to pay that bill quarterly if you are not receiving Social Security benefits. I have had people who try to pay month by month. I've also had people who have tried to pay a year ahead, and for whatever reason, it never works out well for them. You want to pay exactly how you receive the bill, which is quarterly. And one of the big things that happens every year is we get a lot of calls because the media tends to put out these claims that the Medicare Part B premium is going to go up to $200 a month and everybody's going to have to pay $200 a month, even though your cost of living increase was only 1.3%. And I just want to reassure people that there are laws that protect you as a Social Security beneficiary, and it's what we call the hold harmless provision. And essentially, Social Security could never raise Medicare so high that you're forced to live on less than what you made the year before from Social Security. So if you are someone who is on Medicare and you are paying $144.60, if the Medicare Part B premium went up to $200, as someone receiving Social Security already, your premium would not increase to $200 unless Social Security gave a very large cost of living adjustment. However, sometimes those new numbers do reflect people who have not started Social Security benefits yet, or Medicare yet. So if you haven't been drawing Medicare, let's say, and you start January 1, the premium could be $200. It just kind of depends. So there are times in the past, and there may be times in the future where people pay different Part B premiums just because of when they start and what the historical cost of living adjustments have been. Is there any questions that have been sent in about this original Medicare Part A and Part B?
We don't have any questions yet, Michelle.
Okay. So ways to supplement your Medicare. There are a couple of different ways to supplement your Medicare, and you can keep just original Medicare as your insurance benefit. But most people decide that, Medicare alone is really not enough. They're concerned about out-of-pocket cost. And there are some ways to protect yourself, and it would be signing up for one of these two plans, types of plans. So Medicare Advantage plans, or Part C, so this is where Medicare starts to get a little bit complicated. Medicare Advantage plans are referred to as Part C policies as well. What they are is they're plans that usually have both health and drug benefits in one type of policy. These plans essentially replace Medicare Parts A and B, but you still are enrolled in Medicare Part B and must still pay the premium. So at the beginning, when we were talking about the new Medicare card, I mentioned that people with Advantage plans sometimes will file their original Medicare card away. And it's not because they don't have Medicare any longer, but it's because anytime they go to the doctor, the only card that their doctor needs to see is their Medicare Advantage card. And just to kind of give you an idea, some companies that sell Medicare Advantage plans could be Priority Health or Blue Care Network or Humana. They are private companies that have these type of policies. And they do usually cover both health and drug benefits. There are some plans that do not include prescription drugs, but most of the plans include both. One of the really nice things about these plans is that they do offer some additional benefits. So many of the Medicare Advantage plans have dental, vision, over-the-counter, out-of-state, and fitness benefits. So you can get some basic dental included at no additional cost. they may offer you the option to upgrade that coverage at an additional cost to have better coverage for your dental needs. And dental is one of those things that original Medicare does not like to cover. Covers very, very limited dental benefits. And so this is a huge seller of these supplemental plans. The over-the-counter benefit was a new benefit we seen last year, where you can purchase some over-the-counter medication or medical supplies, and you're given a certain amount of money to use every quarter to purchase these medical supplies, so you don't have to pay for them out of your pocket. And this is really nice because some medications like allergy pills and a lot of medications you would take for acid reflux may not necessarily be covered by your prescription drug plan, but you can purchase them with your over-the-counter benefit. Out-of-state benefit is relatively new, but it is exactly what it sounds like. So with an Advantage plan, they are network-based plans. You know, if you sign up with a plan, say with Priority Health, you want to make sure that what provider you're going to accepts your insurance policy. And if you have an Advantage plan, if you're out of the network, you typically do have to pay sometimes an additional cost, sometimes full cost for those benefits or the services you receive outside of your network. But with this out of the state benefit, if you split your time, let's say between Michigan and Florida, well, Florida may not have a Priority Health network there. And so you could still see your doctor or see a doctor or a specialist while you're in Florida with this out-of-state benefit without having to pay anything extra. It does not apply to every single service covered. There's a lot of restrictions. Sometimes it doesn't even go to every single state, but it is an option on some plans. One thing to know is that even with Medicare Advantage plans, if you ever need urgent care or emergency hospitalization or emergency care, those things are always covered at in-network costs because you need access to that. Obviously, those are for urgent situations, and so they don't care if you're in the network or not. And then the last benefit is that fitness benefit, which sometimes will cover workout classes, sometimes it will cover a gym membership. And a lot of the people I work with really like this fitness benefit. I know right now it's kind of hard to use, unfortunately, with the pandemic, but it is a really nice benefit that can be offered. And one of the reasons why people like these plans, especially in Kent and Ottawa County, prices range based on what county you live in. But in Kent and Ottawa County, these plans are relatively affordable. A lot of plans are offered in the lower price bracket. And they kind of, the important thing to know is that you're still going to have out-of-pocket expenses. It's pretty rare to find one that even has $0 primary care copays. So you will still have some out-of-pocket costs, but it's, paying a $5 copay is a lot different than having a $198 deductible. So a lot of people love them for that. It just, what you're going to pay. There's no weird calculation of what is 20% coinsurance on this service. If you see your primary care doctor, it's $5. And each plan can set the cost for their services. So some will be $0 for primary care. Some may be $20 or $30 for primary care. The plans have some flexibility to decide how much they want to charge for a certain service. The other plan option to supplement is what we call Medicare supplemental plans or Medigaps. These plans are true secondary policies, and that becomes important a little bit later, but they're also sold by private insurance. So before, when I said like with Advantage plans, you only carry your Advantage card. For people who have supplemental plans, or Medigaps, because Medicare gives everything two names, that's part of the reason why this is so confusing. But for people who have Medicare supplemental plans or Medigaps, you will carry both your insurance card from Priority and your original Medicare card. So anytime you get doctor services, you'll have to carry both of those cards. A really popular supplemental provider is Blue Cross Blue Shield. So you would take your Blue Cross Blue Shield and your original Medicare card to the doctor with you. And your doctor would need both of those cards to be able to do your billing. These plans only cover health benefits. That is another way that they are very different from Medicare Advantage plans. So with Medicare Advantage plans, you'll get both health and drug benefits in one. And with Medigaps, you're just getting a health benefit, and you still need to buy that prescription drug plan separately in most situations. The other way that Medicare gets so complicated comes down to these Medicare supplemental plans and how they're named. So they're named after letters, and a really popular plan in the state of Michigan, and I think probably throughout the country, was a Plan C Medigap. So we have Part C for Advantage plans, and then we have Plan C for Medigaps, and you can kind of see why this gets so confusing. But basically, when you buy a Medigap plan, the important thing to know is that each letter is an equivalent plan, no matter which company you're buying it from. So a Blue Cross Blue Shield Plan C is the same plan as a Priority Health Plan C. And although they're the same plan, the companies can charge different amounts for those policies. So it's really important to kind of know what benefit you want, and then to shop around with different companies to see where you can get the best price. A lot of people really used to love these types of plans because they have no network. They're really great if you do a lot of traveling. I'm starting to see more and more people in retirement who are living more of a nomadic lifestyle out of a motorhome or with a trailer. And if you're going to be going from state to state to state, a Medigap is still the best option for you because there's no network. But if you're going just between 1 to 2 states, say Michigan to Florida or Michigan to Arizona, some of these out-of-state benefits now with the Medicare Advantage plans actually make them still a better option. It kind of just depends on your traveling. I say, traveling is one of those big considerations for you when you're selecting a Medicare plan. And it's definitely something, if you talk to me or Brianna about, if you meet with us or if you meet with an agent, if you're planning to travel, you need to be pretty upfront about what those travel plans look like for you. And these plans are called Medigaps because they generally fill the holes of original Medicare, except you're often billed the Part B deductible, which was $198 in 2020. So Medigaps C and F after 2020. This was big last year, but I just want to touch on it this year. So as of January 1st, 2020, Medigap plans C and F were no longer able to be sold to new beneficiaries. C and F were by far the most popular Medigap plans that were available because they covered 100% of your out-of-pocket costs. And that is really good for some people. If you have a lot of medical needs, not having to go to your doctor and pay a copay or the hospital and pay a copay is really nice to know that you're never going to get a bill. But they did change that. These plans can no longer be sold. But there is an exception for people who maybe started Part A sooner than January 1st, 2020, but were maybe still working and delayed their Part B benefits. Essentially, if you have your Part A date and it started before January 1st, 2020, you can still enroll in a C or F plan. And one of the things to consider if you are someone who had a C or F plan previously is as less and less new people can join the plan, and as the people on the plan continue to age and get older and maybe needs increase, price will likely increase. And so some people may want to think about changing from the C or F Medigap to maybe a G or N, which are the new plans that are really being pushed. But the important thing to remember is that underwriting actually applies to these policies. So remember on the last slide, I said the fact that Medigap plans are a true secondary insurance would come back to be important, and it's because of this. So with the Affordable Care Act, people with underlying health conditions were protected and able to sign up for health insurance without medical underwriting when it came to their primary insurance only. And so Medigaps are secondary insurances, so they do not have to follow that rule. So they can put you through medical underwriting if you decide to sign up later. The only time you're safe from that medical underwriting is when you first turn 65 or when your Part B benefit first starts, depending on what happens later. So if you work past 65 and let's say you retire at 67, as soon as you start that Part B benefit, that is when that 6-month window kicks in. Otherwise, it's the first 6 months that you turn 65. So if you're someone who has health conditions and you think, paying more every month in your premium, but having kind of this full coverage is the best option for you, you want to do that when you first turn 65. And then Medigap plans G and N. So these are the new plans that are being pushed. How I said that, and I shouldn't say push, that's not really the right word, but the ones that are being promoted the most. And unlike the CNF plans where I said they really cover everything 100%, these policies do still have some out-of-pocket cost, but on the flip side, they also have lower premiums. So you are going to save on your monthly premium, but you're going to have a little bit more out-of-pocket expenses. So Medigap Plan G covers 100% of your Medicare Part A services. So from day one, if you go into the hospital, 100% is covered. But you do pay your $185, which will likely increase next year, Part B annual deductible. And after that $185 deductible, Part B services are covered at 100%. So really, the most you're going to pay for your medical service in a year, if you have a Medigap Plan G, is whatever the Part B deductible is, which we can say is about $200. And I think it will probably stay in that ballpark for a while. Medigap Plan N benefits are very similar. So again, you get 100% coverage for Medicare Part A services. You do pay the Part B annual deductible, just like with Plan G, but the only difference is for ongoing services after that deductible, you do have small copays. So it's a $20 copay for any outpatient services, and that is primary care or specialist. Outpatient services, $20 copay, and emergency services are $50 copay. So those are the only copays you pay. N plans tend to be a little bit cheaper than G policies, and I wouldn't say that either one is better than the other. It kind of just depends on what your specific health needs are. And a lot of Medigap before last year, I would say, like, if you wanted to get a Medigap plan, one of the benefits that you're giving up is that dental coverage that you get with Advantage plans. But there are a couple companies now that let you buy supplemental dental. Some even come with a fitness benefit. So we're starting to see some of these plans look very similar to Medicare Advantage plans. So you can still sometimes get these extra benefits that people are really interested in. And then this just talks a little bit about the extra benefits through Advantage plans. So basic included benefits. Most Advantage plans have basic dental, which will cover cleaning and exams and x-rays at no additional cost. Sometimes it's 1 time a year, sometimes it's 2 times a year. The plan can set those rules, but you can get a basic benefit with no additional cost. Again, they do usually cover a fitness benefit. I think all the plans this year come with a fitness benefit, so that's huge. And a lot of times you can get $0 copays if you use their preferred pharmacies. Again, that's with some plans, and on your more common generic medications only. But that's if you use their preferred, usually mail order pharmacy. And then there's optional benefits. And for optional benefits, we call these riders. These are things that you have to pay extra for, but you can either enhance or add these benefits to your plans. So traditional riders that we have seen in the past and still see today are for dental, vision, and hearing. So these are an upgrade. Sometimes they're $30 a month, and then you get a $1,000 out-of-pocket limit for any dental needs that you have. Usually that $1,000 is with a copay. So, you might pay 50% for a service, but you still get that $1,000. Then there's also some new riders, and these change from plan to plan, and they're not real common in Kent County yet, at least not a couple of them. And some of these new riders could be transportation, pest control, or meals. I don't think in Kent County, unfortunately, that we have any that do have transportation or pest control. But meals, there are some plans that have a meal benefit. And what that is if you know that you're going in for hospitalization, may not be able to cook your own food after your discharge, they will cover any meal service that needs to be provided. Okay, and before I go on, I just want to check in and see if we have any questions so far.
Oh, sorry, I was muted. No questions yet, Michelle.
Okay, thank you. So for some people, you can have Medicare and Medicaid. Typically, this is people who are low income, 100% of the federal poverty limit. That's a gross amount that's less than $1,100 a month. But if you make less than that, you can have both Medicaid and Medicare. In the past, when we had a reoccurring relationship with some sites where our advice about what someone with Medicaid would want to do has changed. And so that's why this slide is in here. A lot of you may be new to our program and to our services. And so this might be the first time you're hearing this. But typically what we would used to tell people that had Medicaid and Medicare is that you want to keep your original Medicare and you want to keep original Medicaid and enroll in a standalone prescription drug plan. And the reason why you want to do this is because there's no networks and all of your needs are covered, and it's in the least confusing way. You take your Medicare and your Medicaid card to the doctor, you show them both, everything is paid 100%. However, a few years ago, there was a change for people that had Medicaid, and it allowed Medicaid health plans for people who have Medicare as well. And there's a lot of additional benefits that someone who receives both Medicaid and Medicare can get from enrolling in these plans. And so basically, you can enroll in a Medicare Advantage plan, and you're going to get all of those additional benefits that come with that Medicare Advantage plan. So if that's dental and vision and the over-the-counter benefit, you can still get those benefits, while at the same time, you may be able to get some benefits on the Medicaid side, such as transportation. So we talked about Medicare Advantage plans, unfortunately, don't have any transportation option in Kent County. But Medicaid almost always comes with a transportation benefit. Medicaid also comes with a dental benefit, but it's a lot harder to use than the dental benefits that are offered with a Medicare Advantage plan. And so someone who has Medicare and Medicaid may seriously want to consider enrolling in like Priority Health Medicare and Priority Health Medicaid, or Blue Care Network Medicare, or Blue Care Network Medicaid. I think Humana also has both a Medicare and a Medicaid plan, just because then they can get all the benefits of the Advantage plan for Medicare, and they can get all of the extra benefits on Medicaid. There are some special programs that can offer care management if your primary insurance is with a specific provider. And you will even though Medicare Advantage plans typically have copays, if you have Medicaid, you will not be charged those copays. So it would still be free for you to get primary care or specialist care or hospitalization. But the big change is if you choose to go this route with the Medicare Advantage plan and the Medicaid health plan, you do have networks that you need to worry about that with original Medicare and Medicaid alone, you did not have. And so it's not a great choice for everybody, but it is a good choice for most people to take both the Advantage plan and then a Medicaid health plan. Okay, so prescription drug plans. This is by far the biggest thing I get questions on. So prescription drug plans are called Part D policies as well, so they kind of are interchangeable. And the biggest question I get is, do I need both a Part D and a Part C, or do I need both a prescription drug plan and an Advantage plan? And the answer is no. You only need one. So if you enroll in a Medicare Advantage plan, you do not need to enroll in a separate prescription drug plan because your drug plan benefits are coming through that Advantage plan. And there are many plans available in the state of Michigan. There is a lot. We have a lot of Advantage plans in Kent County and Ottawa County, and we have a lot of prescription drug plans throughout the state. And each offers varying coverage. So premiums will vary, deductibles will vary, what medications will cost, or what medications will be covered and what they will cost will vary from policy to policy. These plans are sold by private companies as well. Some of the biggest drug plan providers that I can think of off the top of my head are Cigna, Aetna, WellCare, Humana. There's a lot of companies. And these plans are the ones that are most likely to change from year to year. So if you are someone who has either original Medicare and a prescription drug plan, or you have like original Medicare, a Medigap, and then a drug plan, you want to make sure you're checking in on this drug plan benefit because they change a lot and they change almost every year. And so you really want to make sure that your plan is going to continue to work for you. And the plans can have a deductible of up to $445 for 2021. So that is a number we do know. And, last year, the really good news was, the donut hole has reduced itself to the smallest amount that it will ever be in 2020. And for a lot of people, this saves them a lot of money. But the one important thing to know is that your drug coverage may still vary throughout the year because although the donut hole closed to the smallest amount, it did not go away completely. And so you may still see some fluctuations if you're taking expensive medications. People with insulin, inhalers, and biologic medications by far see the most fluctuating of their prices throughout the year. If you are someone who is struggling with your medication prices because of the fluctuation, I definitely recommend that you check in with someone every year to make sure you're on the best plan for you, as well as someone who's going to assess what other programs are out there that might be helpful for you. There are some assistance programs through either Social Security or the state of Michigan, but also a lot of drug manufacturers offer programs as well. And that's something that we do in a counseling session is talk to you about, okay, like if you're struggling with this medication, is there a pharmaceutical assistance program out there that could be helpful for you? And I touched on the plans changing drastically from year to year. Although the deductible on plans has become increasingly common, so have deductible and copay exemptions. And what I mean about when I say exemption is on a lot of plans, if you take cheap generic medications and you go to their preferred pharmacy, it is possible that you may not have a copay on those medications and you may not have to pay your deductible. Even if you do pay copays, they may be exempt from the deductible. And so it is important to check these every year too, for the simple fact that pharmacy preference for these plans change often. So just because your plan maybe gave you good pricing at Walgreens in 2020, maybe now the preferred pharmacy has changed to CVS. And your plan should communicate that information to you in writing. But I know, because I've seen the amount of mail that comes to Medicare beneficiaries during open enrollment, and especially when you're new to Medicare, and it just becomes overwhelming. And so things like that are easily missed. And that is something that we can help you look into as well, is what plan is best for you if you use this pharmacy. We have the ability to compare 2 to 3 pharmacies on the Medicare website when we provide counseling. And so, you can just tell us the pharmacies that are close to you. We can put all of those into the computer and see which ones has the best price. So the main reason why we're here is because Medicare open enrollment starts tomorrow. It will run October 15 through December 7, and it is so important to check your plan and evaluate your plan annually. Because we provide unbiased insurance counseling, a lot of times don't even suggest to someone that they change their plan. If it is working for you and you're okay with the changes happening for next year, it may be worth it for you to just stay on the same plan. But if something does change and maybe prices go up in a way that are unexpected, we can also give you that information. One of the biggest tools that we send out every year is we have a comparison grid, and it's for the Medicare Advantage plans. And it has every plan side by side with the copays for each service. And I get a number of returning clients every year who really just want that grid, because they just want to see their plan next to what else is out there in the market, and just to make sure that they're happy with their plan selection for next year. So I added this on here because Social Security, as the full retirement age has increased through Social Security, people are choosing to work later. And I get a lot of questions about, what do I do if I'm still working? Like, I'm turning 65, I'm getting mail telling me that my Medicare is getting ready to start. What do I need to do? Well, if you are employed by a large employer, most likely you're going to want to delay your Medicare Part B enrollment. Now, Medicare Part A, you can sign up for, and it will happen automatically. But you want to keep that benefit in most circumstances because it just helps your employer plan. Basically, Medicare pays a part, and then your employer plan pays a part, and you will pay the same amount that you would have paid on your employer plan, but you're saving your employer's insurance company some money. And so a lot of people choose to do that. But that Part B delayment is really a big issue, because if you start your Part B early, your guaranteed issue rate starts when your Part B starts. So if you are someone who is working, you want to delay that Part B benefit as long as you work for a large employer. And that way, when you decide to retire and to leave your employer plan, you can get your Part B at that time, and your guarantee issue rate will start with you. And that guarantee issue rate is really the important thing for getting into a Medigap or a Medicare supplemental policy. The other thing that I'm getting more and more questions on, because these employer plans are becoming more common, is about people who have HSAs or health savings accounts. If you are someone who is still employed and starting Medicare and you have an HSA, you can continue with that HSA policy. But the thing you want to check on is if you're able to contribute to that fund anymore. And there are some specific rules about that. I can go over those with you one-on-one if you have questions. But the big thing to know is that you may not be able to contribute to that HSA anymore. But that doesn't mean you can't use the funds of that HSA. And if you are retiring with a large HSA fund, you can use that money to pay for your copayments for your Medicare Part B premium, essentially reimbursing yourself for your Part B premium. Or if you're someone who's getting a bill, you can, for your Part B, you can pay that from your HSA. So you can still use those funds. You don't need to rush to hurry up to use them before your Medicare kicks in. You can hold on to those funds even once your Medicare starts, but you may or may not be able to continue to contribute to those accounts. And that's why I added this last note to always talk to your human resources department regarding your company's policies and rules about, okay, you're starting Medicare, this is what you need to do. Now, if you choose to delay your Part B enrollment and you choose to sign up later on at 66, 67, whatever age you decide to retire, your employer in your HR department is probably going to have to provide proof to Social Security that you had what they call creditable coverage during that delayment period, which if you work for a large employer will not be a problem. If you work for a small employer or you are self-insured, if you're, self-employed, you will likely want to take Medicare, but that might not necessarily be the case, especially with small employers. So, specific questions regarding, I'm getting ready, to start Medicare, I'm turning 65, but I am not planning to retire. Those are questions that I can easily answer. So do not hesitate to call with those. So we have Medicare General Open Enrollment, which is October 15 through December 7, which allows you to change any sort of plan that you want to, with the exception of the Medigap, because that requires underwriting. But we also have a Medicare Advantage or a Plan C or Part C open enrollment period. And this is a time from January 1 through March 31 that you will be able to sign up for a Medicare Advantage plan. If you had an Advantage plan that you maybe stayed on for 1 year and you're not happy with it the next year, you have the ability to change plans. This is actually backwards here. I just noticed that. You can also go into an Advantage plan as well if you had a prescription drug plan, not the other way around. You can opt out of an Advantage plan, I believe, but you may not be able to sign up for a prescription drug plan. So you may not want to do that. Two other common questions I get, which I did not put on here before we go on to the next slide, is about enrollment for Part D as a requirement or the prescription drug plan and Medicare Part B. Medicare Part B and Part D do have late enrollment penalties. So if you are someone who is starting Medicare, you want to either sign up for an Advantage plan or a prescription drug plan, because if not, you do get penalized for late enrollment. And we have really cheap plans in the state of Michigan. If you take no medications, we can help you sign up for a really cheap plan. That way you are just meeting that requirement. And that is really important because the penalty for late enrollment into the prescription drug side of Medicare is really steep. It's 1% every month that you should have signed up and didn't sign up. And that percent is based on what we call our benchmark, which is the average cost of a plan in Michigan. And that percent rate can go over 100%. So it never stops building up, and you pay that penalty every month. So it is really important that even if you take no medications, we have some Advantage plans in Kent and Ottawa County that have no monthly premium. If you don't want to go that route, we have some prescription drug plans that are about $15 or less a month that you could sign up for, just so you do have that coverage, first of all, if you ever need it. And second of all, you're not going to be penalized later. The other penalty is for late enrollment into Medicare Part B. If you are still employed, you do not pay late employment, or late enrollment penalties. So if you're still insured through your employer because you are working when you turn 65 and then you want to retire at 67, let's say, and take your Medicare Part B benefits at that time, there is no late enrollment penalty to do so. But if you had no other insurance coverage and you should have started Medicare, you very well can be penalized. And again, it's a steep penalty. And I hear a lot of, like, well, not a lot, but sometimes people that choose to opt out will say, I don't want to have to pay this monthly premium for Medicare Part B. And if I go to the hospital, I'll just apply for the charity program or the financial assistance program, depending on where you go. And just so you are aware, if you're thinking about making that choice, if you choose to not sign up for Medicare Part B, you cannot get financial assistance through the hospital system. So if you're eligible, you do need to take it to get financial assistance. And it's just the best thing that you can do is to sign up when you're first eligible for it. Before we go on, Kip, do we have any questions that have come in?
No, we don't.
Okay. So one of the biggest questions I get from people is there help? Because I am struggling to pay for Medicare. It is a misconception that Medicare is free or cheap. Medicare is neither one of those things. Medicare is an entitlement program. It's something that you earn through working. It is not a welfare program. And so therefore it is not free. It can be very expensive. And so there is help for people who are struggling. There's a lot of different programs out there to help people. And this under part here tells you what is the max gross income for a single or a married person and what the assets can be. If you think you need help, the one thing I want you to know is that the assets are significantly higher for Medicare assistance than for any other program out there. And that is so important, because what happens, unfortunately, and what happens a lot, is people think that they only can have $2,000 or $3,000 of assets, and they spend all of their money trying to pay their medical bills until they have $2,000 or $3,000 left, when in reality, they could have gotten assistance at $14,610 if they're single, or at $29,000 for a married couple. So don't wait to ask for help. It's better to call, even if you're above these limits slightly, it's better to call early than to wait too late, because what we want to do is help you intervene as early as possible to get assistance. That way you can hold on to the most of your money and still get the help that you are qualified for. So and these programs will help with things like prescription drug costs, prescription drug deductibles. If you experience that donut hole, sometimes that will completely go away. And it will help with your monthly premiums for your either Advantage plan or prescription drug plan. And there's even programs out there that will help pay your Medicare Part B premium. So, that's $150 a month, likely starting 2021. And that's huge to save that every month. So if you think you need help, don't hesitate to call and reach out and ask, because there are programs out there to help. And, on the lowest end, if you have really limited income and assets, know that Medicaid may be an option for you as well. If by any chance you are married and then you have other household members that are dependents, the limit goes higher based on the more people in your household that are dependents on you. If you are co-residing for any reason, either with a roommate or with a significant other, but you're not married, know that for these programs, they only care about you and your spouse's income. So if you are not married and you have a roommate, let's say, the programs are dependent on each one of you and what your income is. That's really important, because food assistance through the state is based on household income and size. But for these programs, it's determined a little bit different. The other thing to know about these limits are if you are someone who is still working, the calculation is very, very different. So if you are still working, and even if you receive Social Security and you're still working, if you are struggling with your Medicare costs, don't let these limits stop you from calling us, these income limits, because the income calculation is very different and you can earn a significantly higher level of income and still be eligible for assistance. And like I said, our goal is to help you get assistance if you need it sooner rather than later. If you're a little bit over, especially if it's assets, we want to talk to you about, okay, you are a little bit over, but maybe in 3 months, you'll be at these limits. As far as the asset limit, the other important thing to know is that if you own your home or if you're buying your home, that does not count as an asset if you are living inside of that home. So that doesn't count. The other thing that doesn't count is a car. And if you're a married person with 2 cars that you own, the most expensive car is excluded. So if you have a 2015 Ford Explorer, let's say, and a 2000 Saturn that is just sitting in your yard, it doesn't run, that Ford Explorer, the 2015, that newer vehicle, the nicer vehicle, the one with more value, is excluded from counting as an asset. The one that counts is the one that is not running, or the cheaper one. So you can actually own 2 vehicles. Just one is going to count towards your asset limit. So the biggest news for 2021 is that there is an insulin savings program this year, and I am so excited about this because insulin is one of those things that is life dependent, but is so expensive. So this is a pilot program for 2021. It will likely continue into the future. I think there are some years it goes forward. And it is an option. Plans could choose to participate. Some plans chose to, some did not. So just because you're on a plan does not mean you're absolutely guaranteed this insulin savings program. So if you are someone who takes insulin, if you have never checked your plan before because you've always been happy, this is the year to check your plan because it's not even down to the company. Like there's some companies that offer 7 plans and maybe only one of them is participating in this insulin savings program. What this insulin saving program is it's a maximum copay amount of $35 for certain types of insulin. And I saw the list of the insulins that are covered, and it is much more extensive than I was expecting. I was really surprised with the list that I saw. Some of the most expensive insulins on the market are covered by this $35 a month copay. And that is huge because some of these insulins can be $300 plus a month if you are someone who falls into that donut hole. So if you are someone who has insulin, you know exactly what I'm talking about if you've been on Medicare. And so this $35 copay maximum is huge. The other thing is that the $35 copay will stay the same even if you hit the donut hole. So if you are someone that's had insulin in the past and let's say it was, the donut hole is like it's a $40 copay at the beginning of the year, and then come August, it's $300 for this month's supply of insulin. Your other medications may go up when you hit the donut hole, but your copayment for that insulin is going to stay $35. And the last thing to know about it is, the program's not perfect. So if you take, and a lot of diabetics do, if you take more than one type of insulin, you may have a $35 copay for each type of insulin you're taking. Again, it's not every type of insulin, but it is a pretty extensive list. The other big thing is that a 30-day quantity limit may apply. So the $35, you may not be able to necessarily get a 90-day supply. If you do get a 90-day supply, you'll probably pay $35 times by 3 for that 90-day supply. But that $35 is still there. It is possible, though, that you may have to fill your insulin every single month to get the $35 copay. And this is great news. It is something that has been needing to happen for a very long time because insulin prices are astronomical. And like I said, it is a life-dependent medication. And so this is really, really, really great news. Again, if you are someone who takes insulin and you at all struggle with the cost, or even if you just want to save some money from your high drug costs, definitely check to make sure that you are on a plan that has this, or at least learn about the plans that offer this as an option. Okay, so now since I've gone over just kind of the basics of Medicare, I want to talk just briefly about what an appointment would look like with us if you choose to do that. My contact information is towards the end of the presentation with a whole bunch of other numbers, but you might be wondering like, oh, I wonder what a counseling session would look like. So the biggest thing, like I had said at the beginning, is that we do not sell insurance. So you may notice that throughout the presentation, I did use some insurance company names. Those are just the ones that like are at the top of my head, but that doesn't at all mean that I endorse any of those plans. We have information about all of the Advantage plans offered in Kent and Ottawa County. We can help you price shop around for a Medigap plan sold by different companies. And we also have access to all of the prescription drug plan providers. So we would help you sign up for whatever plan just makes the most sense for you. We don't recommend insurance. So sometimes people get frustrated because they come to us and they really want us to kind of guide them towards what we think is best for them. We can't do that through the program that we're certified through to provide this insurance counseling, but we can help you narrow down the list of plans so you can choose what might work best for you. We treat every appointment as more of just a conversation. Like I said, we can't guide you toward a specific plan, but we're really going to talk to you about what is working, especially if you're on Medicare already. Like what is working with your current plan? What's not working? What is an issue for you? At the beginning, I said choosing insurance is such a personalized experience. And I really do mean that because, unfortunately, insurance isn't free in most circumstances. And so sometimes what might be best for you on paper may not be what is affordable to you. And so we understand that too. We want to save you money. And we always look for cheapest, but especially in the Advantage plan, sometimes cheaper isn't always better. Sometimes it is. Sometimes you get almost the same quality out of two different price point products. But, we want to save you money, but we want to know that you feel good about the insurance program that you're choosing. Also, we have some people who have always had like Priority Health or always had Blue Cross, Blue Shield, and that's just who they want to stay with because that's who you're comfortable with. And we understand that too. Like we're not going to stop you from doing that or try to talk you out of it. We're really just going to lay out the options for you. We can help you to enroll. To do that, you do have to give us your Medicare number. But if you don't want to do that, we can give you the contact information for the plan exactly, where to call to enroll yourself. We can talk to you and give you information about how to maximize your health insurance selections. One of the things that got overlooked, I think, a lot is this over-the-counter benefit that some of these plans were offering. We'll make sure you have that information. We can talk to you about the dental and vision and hearing riders versus the standard benefit and see if maybe you should buy that extra coverage or maybe it's not worth it. And the most important thing is we really just treat you as the expert of your experience. Like we can't tell you what to do because we're not you. We don't know what works for you the best. And so our whole goal is to take the information you're giving to us and help guide you toward what might be best. Like, okay, so from what you're telling me, these look like these might be 3 or 4 of the best plans for you. What are you most comfortable with? We're not going to argue with you to if you say, oh, I really like this plan, we're not going to argue with you about signing up for that plan. If that's what you want to do, that's what we're going to do. Like you are the expert of what you need and what works and what does not work. Changes to Senior Neighbors Counseling this year. This should actually say from last year. There are some differences. If you have received counseling with us in the past, you know that we typically meet in person. Unfortunately, we are not able to do that this year. We are offering all of our presentations through Zoom. That can be signed up for at our website. We are also which would be the same presentation. So if you're on this one, you might not want to go to the one on Zoom, but if you want to attend twice, you can feel free to do that. If you want an individual counseling appointment, we're able to offer those over the phone via Zoom or Microsoft Teams. I do sometimes just do appointments via email. I usually don't like to do that, especially for someone who is new to Medicare. But I have some returning clients who are just like, hey, here's my med list. Do you mind just running this for me? And that's not a problem either. Or especially if you are someone who just wants the Advantage Plan grid, I can email that out to you. That's not a problem at all. So what we need is a Medicare card. Again, we may be able to do some counseling based without that information, but some of what we would be able to offer about like your specific plan coverage may be limited if we don't have that Medicare number. It's up to you. If you're not comfortable giving it out, you don't have to do that. The other thing is if you are someone who's not comfortable with giving it out and you take 20 medications, I would say be prepared to get as much information as you can from the one appointment and then to maybe call to enroll yourself. We wouldn't be able to enroll you because you don't have your Medicare. We don't have your Medicare number. Second of all, because entering 20 medications can be very difficult and we have no way to save your med list. The other thing is we need a medication list if you have one, because these plans, what works best for you really a lot of time does depend on your prescription drugs. It's not always the case, especially with Advantage plans, but it's really difficult for us to counsel you specifically without that medication list. If you have gotten counseling from us in the past, know that the website changed last year. And so it used to be like really easy. We had we could put in your Medicare number and it would just auto populate like your old medication list. And last year with the website changes, we did lose that ability. So even if you worked with us before and you're like, oh, you have my medication list on file, chances are we don't anymore because of the change to the website. And then last but not least, here is my contact information. So this MAP team at seniorneighbors.org goes to both me and Brianna. So if you email that address, it may go to me or Brianna, just depends on who's covering the email that day. And that number is my direct line, but during open enrollment, Brianna, the other counselor, also does use that telephone number, so she may call you back as well. We just have to have everything centralized so we can kind of work together to get through people as quickly as possible. So that way you're not waiting longer than necessary. I also included some other common numbers. So Department of Health and Human Services, or DHS, or DHHS now, their direct line. So if you have questions for your DHS caseworker, that is how, and you don't know who that person is, that hotline can provide you that information. Earlier, I said if you do not have your Medicare card, your new one, you can call Medicare. That is the number there to do so. Also, the Medicare hotline can help you enroll in a plan as well. I tell people the only downside of working with Medicare is that you're going to have long hold times. So that is the biggest downside. Social Security, that is an important number, because if you think you're eligible for assistance and you don't want to call us to apply, you can call Social Security directly. And that is a big thing, only because if you call us and say, I think I'm eligible for assistance and I want to apply, we do have to have your Social Security number. Unfortunately, it will not let us submit an application without that. So if people don't want to give me that, again, I completely understand, wanting to protect your identity, especially in this day and age. So that is the number that you can call to apply over the phone with Social Security directly. And then the very last number there is MAP's hotline, and that is the state level call number. So if you do not reside in Kent and Ottawa County and you want to be directed to your nearest MAP counseling location, that is the number that you would call. So if you're not, like I said, if you're not in Kent and Ottawa, because unfortunately we're really limited to those insurance providers or that insurance network area, you can definitely call that number and they can get you connected to whatever map site is closest to you. Like I said, it is statewide, so it's all throughout the state. I believe every county does have a counseling location in the state of Michigan. So, how they offer their services may vary from how Senior Neighbors is able to offer the services. Each site is individual, but we all do provide the same type of insurance counseling. So that is what I have for tonight. I do want to offer a chance to maybe take any questions. If you haven't typed them in and you have some, feel free to send them in now. Kip, I'm wondering if we had any that came in.
Hey, we didn't get any specific questions. We did get a comment thanking you very much for the information, saying it was very beneficial. So that's great. We had another question that was more on whether we will save this video to be seen later, and we will keep this up on our Facebook video page, or if you're watching through YouTube, our YouTube video page, so you can see those almost, a couple minutes after this ends. It'll be archived and it'll be there, so you can find it for a little bit. So that's the two comments that we got.
Yeah, if anyone has any questions after this, you can feel free to call or email directly. We can take them. If you have specific questions about your health plan, definitely reach out to us individually. Otherwise, thank you for watching and, for learning. I know that this is not easy information, so sometimes stepping away from a little bit, more questions come up. So don't hesitate to reach out if you do have any questions.
All right, well, thank you very much, Michelle. We really appreciate it. And for everyone, we're doing more programs. You can check them out at kdl.org/events. And thanks so much for tuning in tonight.
Thanks so much for having me.